Welcome back. December 1st is World AIDS Day, designated to raising awareness for the fight against HIV and AIDS. The virus has claimed more than 35 million lives over the last 40 years, and an estimated 38 million people are living with it today. Here to talk about the efforts to fight the epidemic is infectious disease specialist Dr. Shirenza Mazumdar. Doctor, welcome back to 3 at 3. Always good to see you.
Great to see you, Alex.
Let's talk about prevention and treatment for people living with HIV and AIDS. Where do we stand as of right now in 2025?
So we have made tremendous advancements and development when it comes to HIV treatment. So HIV is no longer a death sentence like it used to be. It's now more of a chronic and very manageable condition because of the medications that we have available. So antiretroviral therapy is a treatment that we give to people living with HIV, and it has changed dramatically. It's very easy to take now. It's very well tolerated. And for most people, that involves taking just one pill a day. We even have a long-acting injectable medication for HIV treatment where people can get that every 2 months. And that has really changed the life expectancy for people living with HIV and AIDS. And they can now live a very normal and healthy life if they're on treatment. And that has also allowed people to be in relationships and not transmit the virus to their partners. And medication that's also allowed for safer reproduction, where women who are pregnant and living with HIV, if they're taking medication, they don't have to worry about transmitting the virus to their child.
So it seems like some progress is being made there. But what is the reality, especially right here in Memphis and in Shelby County, when it comes to HIV and AIDS rates here?
HIV in Shelby County and Memphis is very concerning. So we actually rank #2 for new HIV infections in the entire nation. And Memphis makes up 40% of the HIV cases in the state. So our prevalence here in Memphis is twice as high than the rest of the country when it comes to HIV rates, and 3 times higher than the rest of the state. But I think what's even more alarming and concerning is the impact of HIV on young people in our community.
Why young people in particular? Because a lot of people might say, well, I thought this might be something more so impacting adults, but we're saying our young people, what, teenagers?
Yes, and so what we know is that for people between the ages of 15 and 19 years old in our community, the infection rate of HIV has gone up 50% since 2022, and we know that people between the ages of 15 and 24 living in Shelby County, they are 5 times more likely to be affected by HIV than the same age group in the rest of the nation.
So what aren't we getting here? It seems like this is such an ongoing challenge for us, especially our young people. What can we do about this?
Well, I think that it's really important to raise awareness when it comes to HIV prevention. I think that testing is so important. It's so critical for people to know their HIV status. And I think it's really important for people to understand that we have really good preventative options now. There's something called PrEP, P-R-E-P, and that stands for pre-exposure prophylaxis. Pre-exposure means before an exposure, and prophylaxis means to prevent. So HIV PrEP refers to a strategy of giving HIV medication to HIV negative people who are at risk of contracting the virus. And it's incredibly effective. It's over 99% effective in preventing HIV, but it is underutilized. So of the 1.5 million people at risk for contracting HIV in this country, only about 1/3 of those people are actually utilizing PrEP. So it's something that we really need to make people aware that it is available so we can see that uptake increase.
You might have some people here who are still somewhat concerned about, well, what about the privacy of it? Do I have to show up to this public facility, to a hospital to be tested? Can I do it at home these days? What's out there these days, doctor? What are you seeing?
There are so many options for testing, and especially free testing in our community. So for instance, Methodist Le Bonheur Healthcare's community outreach program does offer free testing throughout the city. We've partnered with certain Walgreens locations to offer free testing, and also with the community outreach program at 600 Jefferson Avenue. But there is free testing available at the health department, at Choices, at Out Memphis, and Friends for All. And there's free at-home online testing that people can order if they go to 901hivtesting.com or takemehome.org.
You make it easy for a lot of people out there to share that information. When it comes to, again, our young people, what about Memphis Shelby County schools or local school districts? Do they need to be a part of this conversation, or are they already? What are we seeing?
I think they absolutely need to. Knowing that so many young people are living with HIV in the city and are at risk of contracting HIV, I think it's really important to bring the schools involved so we can get the word out, increase awareness, increase testing, increase treatment, and increase preventative options.
But is it a conversation a lot of people want to have? Because you might have some who will say, no, that's not a conversation we need to have out here, maybe at home, but do we have to have it at school these days, you think?
I think it's really important because it's reality. We know what we're dealing with in our city, and I think it's really important to do all that we can to keep our kids safe.
All right, Doctor, as always, glad to have you back on 3 at 3. Thank you very much.